I'm going to get started because it's 6 o'clock. Hi, everybody. Thanks for coming out on such a cold night, although it feels probably a little warmer today compared to the other days. My name's Kara Feldman-Hunt. I'm the program manager for UVM Integrative Health. And this is the Community Integrative Practitioner Forum. I just wanted to go over a couple of housekeeping items before we get started. We do have parking passes in the back if anybody needs. We do offer CME credits for this, and if you are looking for credit, you can go to the UVM CME website and look for the Integrative Practitioner Forum series, and then you'll see this talk and you can claim your credit. If you didn't sign up, if you could just sign our sheet so I can have your email address and be able to communicate with you. We will post the slides and presentation on our website, which is at it's uvm.edu/IH. We have a few events coming up, and you have a handout, but we have a Laura Mann lecture series coming up on March 5th. It's a physician from Tulane who's coming to talk about culinary medicine. We also will have another forum in February on music therapy. And then this April, we'll have our first integrated pain management conference, which I hope you will all attend. And now I will introduce Jane Nathan. Dr. Nathan is a clinical and research psychologist. She has a faculty appointment at the Larner College of Medicine in family medicine. She has a long history of working with children and families, has been a mentor for first-year medical students for 9 years, and was the director of research at the Stern Center for 15 years. Dr. Nathan has done extensive training at the Benson Henry Institute and is working on implementing their stress management and resiliency training program, or SMART, which you will learn a lot more about tonight, here at UVM. She currently has a UVM Development Fund grant to deliver SMART to patients with chronic conditions and a Frymoyer Scholarship to deliver SMART to OB/GYN and family medicine residents. Take it away, Jane.
Thank you. Can everybody hear me okay? The thing is on. Okay, perfect. Great. Thank you all for coming out on this balmy evening. It feels balmy compared to what we've experienced and what we're going to experience by Saturday, but I appreciate you all coming out. We're very excited to talk to you about the Stress Management and Resiliency Training Program called SMART, applications for healthcare providers and patients. So when I set this up, Kara and Evelyn said, well, why are our names on there? You're giving the talk. And I said, you know, I would be nothing without you. And so I want to give a shout out to Kara, who of course is the program manager of UVM Integrative Health, and Evelyn. Evelyn, come in and wave. There's Evelyn in the back of the room. She is the manager of employee wellness and the family assistance program at the UVM Medical Center. So my agenda for tonight, I'd like to talk a little bit about our collaborative aim and how we came together on this. I want to talk about the Benson Henry Institute and their SMART program. I want to tell you a little bit about what we've done and what we're doing. We're going to take a little break after I blab for a short time and do an actual relaxation response short meditation that Evie Smith is going to lead us in. And then we have a SMART panel of who I see a couple of our SMART panel participants here who will talk about their experience going through the SMART program, what it was like, how they're using this in their personal and professional lives today. And then we'll open it up for questions and discussion. So this all started when I became enamored with the Benson Henry Institute and their SMART program, and I started doing training there a couple of years ago to implement some of the practices of the SMART program into the first-year College of Medicine curriculum. I was a mentor and preceptor to first-year medical students there, teaching a class called PCR. Some of you know what that is. I won't go into it, but it's kind of the softer side of medicine, and was able to do some training at the Benson Henry Institute to take some of these strategies to implement into the curriculum to help the med students learn to deal a bit better with their stress. And in that training, I also went further because I loved the program so much to learn to facilitate groups with patients practitioners, et cetera. I had this hot idea that this really needed to be here at UVM, and I didn't know how to bring it here, although I'm faculty, whatnot. I'm not an employee, I'm not on staff, and everyone kept saying, you got to find Kara Feldman Hunt. I'm like, who's Kara Feldman Hunt? So about a year and a half ago or 2 years ago, I called Kara and said, you don't know me, but I just went through this training, and it was really remarkable, and she's like, we have to talk. Come in on Thursday. I came in, she brought in Evelyn, and they said, you know, we've been looking for a program to bring here to UVM, a unified program of stress management that would be appropriate across settings, both in the healthcare and the academic sciences on this campus. I do want to give a shout out to all the programs that are already in place. There are some wonderful things that go on here. Roz Grossman does a great job. There are several silos around of people who integrate mindfulness and meditation at weekly lunches and weekly meetings. And, you know, there's some wonderful things here, but we were looking for something more academic, more educational, something that went beyond simple mindfulness and meditation that would provide a big array of tools for really anyone who might be interested. So we thought, well, what about the Benson Henry SMART program? So I want to talk a little bit about the Benson Henry Institute, which is the integrative collaboration between Harvard Med School and Mass General Hospital. And I got to give a shout out to Herb Benson, who about 50 years ago, cardiologist at Harvard Med School, came up with this incredible idea that just set the world on edge. You know, how about if slowing down your breath might help treat hypertension? Well, people at that time thought this was insane, that he was a quack, and they tried to fire him at Harvard for 30 years, and he will tell you that story himself. He was ridiculed as a quack, and he didn't care. He studied with the Buddhist monks and the transcendental meditators at that time in the 60s, and he pursued. And what he discovered was something he termed the relaxation response, which we're going to talk a bit about in here tonight, which is really a hypothalamic-mediated reaction that reduces the sympathetic nervous system activity and decreases heart rate, lowers metabolism, decreases your respiratory rate, and increases your blood flow. So it's a very simple process. It's very easy to get into this relaxation response through some very simple breathing techniques, and it's the physiological and really psychological opposite of fight or flight. And in fact, he termed the relaxation response in the very same room at Harvard that fight or flight was termed. We know now the science is in. This is science, okay? It's been proven that these kinds of strategies impact patients in a positive way and impact our own personal lives in a positive way. And the question in the research no longer is, does this work? Does meditation work? Does breathing slowly work? We know it works. The question now in the research is how? What are the neural substrates? What's happening? Why is this so effective? So I put this up not just because it's obviously a stellar picture of me, but when I was doing a training a couple of years ago, there's not many people who are certified facilitators of the SMART program in the world, actually. And I was doing a training with about 6 other people, and Herb, who was adorable, came in and he said, I want to know who's taking my training and why you're here. And as this picture was being shot, he said, you know, why are you here? And I said, well, the story is that my father, who owned a photo finishing lab, the first color photo finishing lab in Boston in the late 60s and early 70s, had a very stressful job. And he was much more innovative than I knew through a lot of my life. But he decided he wanted to find a way to manage his stress. And he found Herb Benson's philosophies in Herb Benson, and he found John Kabat-Zinn. This is my dad. You know, and he started taking classes with John Kabat-Zinn and engaging in mindful meditation, which he tried to relay to us. And what I was saying to Herb at this very moment was, you know, just like Harvard mocked you, we used to mock my dad when he would go do his thing. And he was saying at this moment, isn't it wonderful? We've gone from ridicule to science. So this was very poignant to me personally and professionally in the move that I was taking from what I had formerly been doing. So when we came together as a collaboration, our initial aim was to determine the benefits of the SMART program to some of the leaders on campus and to determine their interest to bring this forward to staff, patients, families, students, etc., in the academic and the health sciences. So I think I'm probably preaching to the choir to most of you, but So what's the problem with stress? And I like to talk about this just a little bit because it is kind of a cornerstone of the SMART program. When we talk about in the program chronic stress, we're talking about bottom-up thinking or red thoughts. We put it in those terms because we're talking about thoughts that are initiated from the amygdala. They're emotionally laden responses. It results in hormone and cortisol release, the inflammatory process that gets rolling, the mood stabilization becomes deteriorated, the neurotransmitters get involved, and you can get into this chronically stress-stimulated response. And that's the fight or flight mode. And I want to give a shout out to fight or flight. It's a wonderful thing if you're being chased by a robber. And if you think about the cavemen, they lived in the fight or flight, right, every day. There was something behind every rock, so they had to really be ready. And they also lived to be about 30 years old, 40 years old. And so for us, we're living 70, 80. If we're in this chronic stress response, we're going to have impaired health. We cannot sustain burning at that level for that long without having infection, tissue damage, poor mood, cellular imbalance. And these are, again, facts. So what we like to talk about in the SMART program is eliciting that relaxation response, and that's what we call top-down thinking or blue thoughts. And that's when we're using our prefrontal cortex instead of our amygdala. We're using oxygen more efficiently. We have better mental and physical well-being. Sleep is better. Digestion is better. Mood. We have a better sense of well-being. And our immune response is better. Everything is better when we can remain in that level head of using that prefrontal cortex. Is it easy? No. This is just kind of a slide that shows the different structures of the brain, and you can see the pieces of the prefrontal cortex are responsible for things like error monitoring, reality testing, attention, thought, inhibition of inappropriate actions, and regulation of emotion. And then on the bottom, you can see that when that amygdala gets going, how it works all the way from the bottom up, and everything is mediated through the hypothalamus. I'm not going to get into this in too much detail. If you have intense questions about this slide, you can see me after. But this is your brain on stress, and what's important to note here is all the pieces that become involved, the adrenal glands, the thyroid glands, the pituitary system, and that green blob is a macrophage. And what the macrophages are white blood cells in your system that sort of act as scavengers, and they go out and they clean up the debris and the bacteria and the fungi and even parasites and go through and keep your system running at a balance. And when your brain is on stress, they're not working appropriately. It's like a vacuum that is plugged up. They're not taking care of business, and instead the inflammatory process gets set off, and infection, disease, tissue damage, etc. happen. So any vulnerability you have physically becomes exacerbated when you're in that stress response. This is how stress affects your body. Again, a lot of you know this. Concentration, all the cognitive impacts, the mood impacts, anxiety, irritability, the cardiovascular impacts. I just read an article this week about women who have cardiac issues are much more likely to have stroke if they're under stress because for some reason women's blood vessels constrict more than men when they're in the stress response. I mean, this is the kind of research that's coming out now. So we know that this is a factor. Joints and muscles become achy. There's a lot of pain from that inflammatory process. The immune system becomes compromised. You're going to get sick easier. You're going to stay sick longer and have a harder time recovering. The skin is affected, the hair loss, tissues. If you get cut, it's going to take longer for your skin to mend itself. And of course, the gut. There's a lot of research on IBD and IBS and the positive benefits of teaching stress management to those patients and how much that helps their physical symptoms. And then there's the reproductive system. I know at BHI they do actual SMART trainings for women who are having trouble getting pregnant because it turns out that stress has an impact and decreases hormone production, decreases libido, and has an increase for PMS symptoms, which that in and of itself is a good reason to get yourself out of the stress response. So what is SMART? So the SMART program was developed over 40 years of research at the Benson Henry Institute. They have been working on this forever. If you go to their website, they have a link to their research, and you can see it all there. It's a program that teaches participants to become resilient to stress over 8 weeks. They're 2-hour group sessions, 1 a week. We do a lot of education, we do a lot of group exercises, and there's a bit of homework. And the 2 things that really struck me about the SMART program that caused me to fall in love as a research scientist and person who is show me the money. If you don't show me the money, it's not that I'm not going to believe you, but I really like to see the research. This provides a wide array of tools, inclusive of all interests, personalities, and motivation, and it includes only evidence-based strategies that are drawn from the positive psych literature, the established cognitive behavioral therapy techniques, and the life satisfaction, mindful, and meditative literature. Again, back to the wide array of tools, I love John KabatZinn's program. I love some of those mindful-based programs. One piece about the stress management program that I appreciate in addition is that it does include the mindful meditative piece, and we're going to get into the details of what it includes. But not everybody wants to sit and meditate for 20 minutes or even can. It provides a full array of tools to get yourself out of that stress response, and I love that. So here are the specific components of SMART. So we start with educating. Those few slides I went over about the brain, we talk to the participants about their brain. What's a red thought? What's a blue thought? When the amygdala is in charge, what happens to the prefrontal cortex, etc. We learn how to elicit the relaxation response through mindfulness and meditative practice. We teach participants how to identify when they're getting stressed in every area of their being so that they can identify it sooner and are able to intervene sooner. In this part I love, the metacognitive part, we start to teach about thinking about how you think. And if you really start thinking about your thoughts and disentangling them, you start to see the unreality of saying things to yourself like, geez, I'm always stupid, I always mess that up. You start to really think about what you're thinking, and is that a positive way to think about yourself? Is that real? And we really work on that to try to get that prefrontal cortex retrained. And then we talk about the promotion of adaptive coping. We talk a lot about the scientific rationale for resiliency-based lifestyle behaviors. We talk about diet, exercise, sleep. We share ideas with everybody, and we also offer a lot of the research-based ideas for how to sleep better, how to deal with insomnia, how to eat better, etc. And we talk a lot about social support. That becomes a very important part of the program as well. And then we deal with motivational and behavioral strategies for successful behavior change. We talk a lot about positivity and gratitude. We don't allow a lot of negative talk and whining or complaining, as we say. We try to put everything in the positive. And again, there's a ton of research, if anyone's into the research on gratitude, it being an antidote for depression, and just, people keep a journal of 3 things they're grateful for every day. And this starts to change the way you think and starts to grow that top-down thinking. So this is a diagram I like. This comes directly out of the folks at Benson Henry, and this is exactly what SMART looks like. I'll try to use this little red dot, which is extremely little. I don't know if you can see it, but we start with eliciting the relaxation response. We do some single-pointed focused breath awareness and some of these classic meditations, body scan, loving kindness, contemplation. We get into a little guided imagery. We talk a lot about mindful awareness and trying to be aware of everything around you. And we talk about some of the scientifically proven strategies that help evoke this relaxation response, yoga being one of them, Tai Chi is another. These are all now in the sciences. And those promote this relaxation response. I mentioned we talk about self-awareness and how stress is impacting you relationally, cognitively, emotionally, physically, and behaviorally. You start to learn to identify those, and then you can learn to decrease that stress response. And then we talk about these adaptive strategies. Again, the positive perspectives, healthy lifestyle behaviors, the cognitive reappraisal and coping strategies, and the importance of social connectedness. And that promotes growth enhancement. And all of these three things together, when it comes together, promotes resiliency. So people are still going to be stressed. Stress happens, but your response to stress can absolutely change. So is there data to support SMART? There is a ton of data. You can, again, go on the Benson website, the Benson Henry website, and see. This is just one example. They did a short 12-hour version of the SMART program with palliative care practitioners. Very stressful job, and those who took the training perceived much less stress after taking the training and had a statistical increase in perspective taking, which is a critical component for any caretaker, physician, any medical practitioner to have. More importantly, with regard to our view of SMART, they did a 2015 retrospective study. They took 4,452 Mass General patients who had gone through the SMART program somewhere between 2005 and I believe it was 2014, and they measured their health care utilization before they took the training and then after, and found that they accessed health care 43% less in the year after participating, which is remarkable. So their clinical encounters went down 42%, the imaging went down 50%, lab encounters went down 44%, procedures down 21%, and emergency room visits were down from 3.6 to 1.7 a year. So this was fairly remarkable. But it begs the question, how does that compare to controls? Well, they compared it to over 13,000 control patients who they matched for healthcare utilization before the training and after, and found that SMART patients still continued to utilize 25% less services across all clinical categories. And when they did the math to determine, well, does this make a difference, they determined and estimated that somewhere between $640 and over $25,000 a year savings of those patients who went through SMART because of that decreased healthcare utilization. So this was enormous. This hit the papers. It was in Newsweek or Time magazine, I forget, but it was big, and so the Benson Henry folks had to grow with the sudden influx of this information and the success of their program. But they concluded that SMART could definitely help reduce individual disease burden and help reduce utilization of healthcare resources. So what does this have to do with healthcare providers? I just have to talk a little bit about the trajectory of stress for healthcare providers. We are in an epidemic with burnout, and what some of these implications are. We know that there's job dissatisfaction, absenteeism, high rate of job turnover. Negative emotional states are significantly higher in the healthcare industry than in others, with increased depression and anxiety, substance abuse and suicide. Poor physical health is a result, sleep disturbance, chronic conditions, frequent illnesses, which cycles back to that absenteeism. And even perhaps more importantly, there's a decrease in empathy, not just for the patient, because healthcare providers, when they're burnt out, become more callous toward their patient, but for themselves. There's less self-care. So it's a very negative cycle. It ends up having a lot of compromised healthcare and lower satisfaction of the patients, and certainly increased medical errors and increased costs in our healthcare community. This is a slide showing burnout as such a very serious epidemic. Anytime you look, this is a hot topic now. There's a ton of research on this, and the data is always changing. I mean, you could find a lot of numbers out there, but somewhere between 50 and 75% of med students and resident physicians endorse clinical levels of burnout. 54% of attending physicians, 37 to 86% of nurses, depending on the units they're in and where they're working, and 21 to 67% of mental health practitioners. If you look over to the other side, the 400 suicides a year by our physicians, that's almost 4 years of classes of UVM med students. Each class has about 110 students in it. That is a lot of suicides. It's twice the rate of the average population. The 39% rate of depression is higher than the average population, significantly so. 24% of ICU nurses test positive for post-traumatic stress syndrome, and there's a high number of emotional exhaustion endorsed with primary care nurses. So this is a big problem, and we need to figure out how to solve it. So what did we do? We got together, we fell in love with our unified aim, and we decided to try and bring the SMART program to UVM as a pilot to see, well, who might take this. We invited 20 leaders and healthcare professionals from the Medical Center, the College of Medicine, and the College of Nurse Science. We had some pretty high-level people in there. A dean was in there, one of the very highest nurses at the medical center, some psychiatrists. We had a couple of people from Blue Cross actually come and take the class. The average age was about 50, mostly female, but not all. And the role was sort of split administrative/clinical and clinical. And we held it on Friday mornings from 8:30 to 10:30 in the morning. And this was January through March, exactly a year ago. Wow, okay. We just thought, who's going to facilitate this? And I remember somebody saying, well, you should do it. You've been trained. And I said, I'm not doing it with these key people. If this is like the pilot, I don't think my first group should be with this group of people. So we came up with this idea, why don't we have the facilitators from Benson Henry come up? Boston's not all that far. Well, who's going to pay for that? Because it was not cheap. And we were miraculously, generously funded through a special employee wellness fund through Blue Cross and Blue Shield of Vermont. And this is unheard of for an insurance company to fund a program like this. It was really ground floor. We did some pre and post measures. We measured knowledge, belief, and practices of mind-body medicine. We used the perceived stress scale, the mindful awareness scale, and we did mid and post training 8-week, 9-month follow-ups, qualitative and satisfaction surveys. So our results initially found that 90% of these extremely busy professionals, and I mean they were top-notch people here with jobs on and off-site, some of them didn't even work on campus and worked moderately far away, participated in 7 of the 8 sessions on a Friday morning. So that says a lot right there. They came, they wanted to come, and they enjoyed coming. We found significant increases in their use of personal daily meditation and conscious mindful practice. We found statistically significant decreases in their perceived stress. If anyone cares, these were all matched t-tests. And our greatest item shifts, people were feeling increased control of the important things in life, less stressed over unexpected events, less nervous and stressed in general, feeling more on top of things, better able to overcome difficulties, and feeling less anger due to things out of their control. We found significant increases in mindful awareness and attention, exactly what we were hoping for. People were rushing through activities less. They were directing more concerted attention to what they were doing, better able to listen with focused attention, probably a good trait for healthcare practitioners. They were better at staying in the present to complete their goals. And less, I love this one, less running on automatic, greater awareness of doing. I mean, how many times do you drive somewhere and you get there and it's like, how did I even get here? I'll go to Boston on occasion and get there and go, wow, I don't even remember driving. That's no good. That's not a good thing. And they become better at remembering someone's name, another good trait for a healthcare professional. So we did follow up, 8 weeks reunion. 15 of the 20 came back again, mid-workday, very busy workday. 86% were still experiencing positive impact on their sense of job burnout. 93% were integrating SMART into their professional lives, and 100% were using some way or another in their personal lives. And 86% wanted an ongoing group connection, and that made us really happy that people wanted to come back, they wanted to reconnect. We had a 9-month follow-up recently. 12 out of the 20 were able to come again in the busy workday, and 100% of them were still using SMART principles in their personal and professional lives. I'll let you read these. We had some wonderful comments. I think I completely enjoyed this. It has expanded the depth of my practices and the services I extend to patients and employees. And this has been one of the most beneficial trainings I've ever done. I mean, that says a lot because these were very well-seasoned professionals who have been through a lot of trainings. So what did we learn? 100% of them enjoyed coming to SMART. They all endorsed that they very much enjoyed coming. And 100% of all the participants would recommend the model for various populations, from leaders to healthcare administrators, patients, students, and families, physicians of all kinds, et cetera. So we were able to secure the UVM Foundation grant, and we're going to talk a little bit more about that, and that's going to certify 3 facilitators through the rigorous Benson Henry Institute process while we're providing the SMART training to 2 groups of patients with chronic conditions. I want to say something about the training process that's required to become a facilitator. There aren't that many certified facilitators in the world, and we're going to have 3 certified facilitators hopefully here by the time it's said and done. It's a very rigorous process. It takes about a year of study with the Benson Henry folks and supervision, and it's a bit on the costly side too. It's at least probably $8,000 or $10,000 by the time you're done paying for those components. So it's not like, hey, I want to do this for a year or 2. This is something that's a pretty serious commitment if you want to. And again, you can go to their website and go to their training, and it's all laid out right there if you're interested. So we got the UVM Foundation grant, and that's what we're doing with that. And I was also privileged to get a Fry Moyer Scholarship with Doctors Laura McCrae and Natalie Feldman to provide a shortened version of SMART with the medical residents. It's called SMART-R. And so we're doing that training with family med and OB-GYN resident physicians this year. I want to talk just a bit. I love this slide. This is how I feel from 1 minute to the next. I mean, I just like this slide. I want to talk a little bit about the resident training. Why train our medical residents? Well, it goes back to burnout. So the ACGME, which is the Accreditation Council for Graduate Medical Education, did a lot of studies, and some of you say, well, didn't they reduce? I've had people say, well, didn't they reduce their hours? Wasn't that like it? And what the studies showed, there's really minimal change, and there's still burnout that occurs. Regardless, it helps to reduce the hours, but it's not solely a time problem. And so there has been a plea. I was just at a conference in the fall where it was all about medical trainees and healthcare professionals and burnout, and a plea to please, what are we going to do? How are we going to manage this? We need individual intervention. There needs to be system change and organizational change. And so this SMART-R training is a part of that individual change. One of the solutions that's been offered is that mindful living in practice make for better docs. So they have healthcare that stands out. They can empathize more importantly with their patients. They're better able to find meaning in their work and are happier, more balanced people. And so the bottom line is happier docs, better work environment, improved patient care, and lowered costs for everybody. SMART-R was designed by the residents at Mass General Hospital. So they saw their patients going through SMART, and they thought, wait, why can't we have this too? And in fact, the Benson Henry group now is running the full 8-week SMART program with the physicians at Mass General Hospital, and they're showing up, and they're coming, and they're loving it. So it's just a bit abbreviated and takes some of the key components out of the full 8-week program. So what we're doing right now is we're running 3 2-hour SMART sessions with the OB-GYN and family meds. I am texting self-care reminders in between because they have a session in October. The next one is in a few weeks, and then they have one in May, which, you know, when they leave the room, they're so busy and there's so much on their minds, they're just not thinking this, they're not living this based on 1 2-hour session. So I am piloting, texting them, those who were interested, self-care reminders once a week, and we'll see how that goes. And then we're evaluating pretty much the same things that we evaluated with our pilot. We are including a 2-question burnout and empathy to see how that looks. And we will have a second year. That is a 2-year project. We're not sure yet, but we may open that up to all interested residents. I don't know. We're not there yet, so we'll see. So that brings me to my last slide. So we are looking for volunteers for our research study. We are running the first group. You probably took a flyer when you came in. Our first group of patients with chronic conditions begins January 16th and runs through March 6th. The criteria to be in this group is that you have to have a medically stable chronic condition diagnosed by a physician and have it for about a year with no serious mental health issues, substance abuse issues, no recent or acute physical issues, no new diagnoses. So really a patient who got diagnosed a year ago with diabetes, has the particulars under control, but really could use some strategies to learn to deal with the stress of managing that disease. And that's the kind of patient or person, staff, employee that we're looking for. The cost is free thanks to the grant. It's a $550 value. And our recruitment is now in process, and I'm delighted to say that we listed it one day on the intranet, so people in-house at UVM Medical Center saw it on when they opened up their computers, I guess. And I don't know, how many responses did we get from that? 200? Like in a day, 200 employees said, I want to take this class. And so we're weeding them out now, and we've got 13, I forget how many, the group is almost full. But we are running a second group, probably April and May is my guess. We're settling on those dates now. And so we want you to continue to think about yourselves, your staff, your patients, those who might benefit from this kind of a training. And so I'm going to leave you with this information that you can copy or take, or it's on that handout that you have. That's all I have to say. I guess we'll save questions for the end. I see you're all burning with questions. I can feel it. And we're going to have Evie lead us in a moderately short, 5 to 10 minute, whatever, however it goes, short meditation that's going to hopefully elicit your relaxation response. And I'm going to hand this over to you.
Okay. How's that? Can you all hear me okay? Okay. So this is basically just going to be a 5 to 10 minute experience of the relaxation response, and it's something that I designed in honor of Dr. Herb Benson. I'm incorporating the 4 steps that he identified that actually elicit the relaxation response. So you're welcome to participate or not, but if you don't participate, just feel free to observe quietly. And if you would like to participate, I'll invite you to just sit upright comfortably in your chair. And just feel free to close your eyes and rest your hands in your lap and your feet flat on the floor. You're welcome to either close your eyes or gaze at your hands. And to start, I invite you to take notice and adjust your level of body posture and comfort. Sit comfortably and tune into your body and how it feels to be comfortable in your body. Noticing how you feel, just sitting comfortably in the body with all of your muscles relaxing and letting go of any held tension. Breathing in and out comfortably for about 1 minute. And now, let's just sit quietly and tune more deeply into the silence. Listening to the silence. Observe the essential, quiet feeling as it flows in, through, and around your whole being. And enjoy this experience for about 1 minute. And now let's observe our passive, receptive, and open attitude. If the mind wanders or places judgment, observe it and just breathe in and out and resume the passive, receptive state of being. Observe this passive state and notice a sense of peacefulness settling in, around, and through you for the next minute. And now we will attend to our breathing as the object of our attention and dwell on the in and the out breath. Focus your attention on breathing in and out, in and out. You can say the words in and out to yourself and repeatedly return to the breathing if you become distracted. And for the last minute, quietly take notice of the total feeling of the relaxation response as it fills your whole being. Breathe in the whole sensation of relaxation as it moves in, around, and through your body, mind, and spirit. And carry this feeling with you as you encounter the various events and people throughout your day. I suggest you take refuge in the breath. Surrender to your in-breath. Identify with your in-breath. Mindfulness is to always arrive in the here and now, to be at home in the here and now. And on the count of 3, you start noticing yourself in the chair. 2, moving your feet and your hands. And when you're ready on the count of 1, feel free to open your eyes, feeling relaxed and recharged.
Okay. Everybody awake? It's okay if you fall asleep. Some people do that. So that's just a little sample. We do a lot of that kind of thing. We do what's called minis, which are very much abbreviated. Breathe in through your nose, count 4, hold 4, full belly exhale, count 4. That can be miraculous to do in about 2 seconds. You do that a couple of times, and the relaxation response is immediately evoked. So, all right, so now we have a panel of people that I would like my panel to come down here, please. You know who you are. Put you on the hot spot. Hi, guys. So these are 4 of our favorite professionals who took our SMART training. Am I not on? Oh, thank you so much, Kara. And so I've asked them to come just so that you'll have an opportunity to ask them questions, but I'd like them each maybe to say who they are, what their role is employment-wise here at UVMMC, and to talk a little bit about their experience taking SMART and maybe how they're using that personally and professionally as a result of having that training.
Okay, hi everyone. My name is Benson. I'm one of the employee family assistance counselors here at the University of Vermont Medical Center. As you may know, our role in that capacity as a counselor is to help employees and family members to balance their work and home life. So essentially, it's a natural fit for me. This program, the SMART program, was a natural fit for me in my role. And I would like to just also say that way back in the 1970s, I had an interest in these topics. I was reading the Prevention magazine, the Yoga Journal was just coming out. I did buy Dr. Benson's The Relaxation Response back in the mid-70s after that was written. And I just had a natural inclination towards these lifestyle practices. And not only was Dr. Benson considered, what did you say, he was a quack. My interest in these natural lifestyle principles was unusual for a late teen or early college student, and many people thought I was a little wacky myself. So at any rate, for myself, I'm really happy to see that sort of like 30 or 40 years later, now science is endorsing these practices. And so I'm very interested in helping employees with regard to dealing with stress and anxiety and depression, which is fairly prevalent, as Jane's slides pointed out, to help employees be their best selves by learning some energy management principles and self-care strategies that the SMART program endorses and validates. I think, what else were we going to say? How you liked the SMART program and specifically maybe what? Yeah. I mean, the SMART program for myself was, well, the fact that it did endorse something that I've long held as a lifestyle practice and have it scientifically validated was very good to see, but also the social connectedness that happened for myself with regard to meeting my other panel members, but many other professionals that I would not have had the opportunity to meet and now work with more closely. So I've been very appreciative of that experience. And so I think that's good for now, and I'll pass the mic over.
Yeah, thanks, Ellie. I can't remember exactly what I was doing in the 1970s.
Were you born, Andy?
I don't think I was born. Yoga Journal. So there we go. I can really hear me. My name is Andy Rosenfeld. I like to think of myself as one of those very high-level professionals that Jane was talking about. But I'm not, actually. I'm a psychiatrist here, and I work with families. So I work in the pediatric psychiatry clinic. And my hope is with the SMART program that we will develop a group for depressed and or anxious teens, adolescents. It really jibes well with the model that we use, which is a family-based approach. So we do a lot of the same focus on nutrition, sleep, mindfulness, et cetera, so that SMART has really enhanced my sort of, I think, my efficacy, but at least my comfort level and confidence in prescribing those things and practicing them with families. Today was a good example. I got to do a body scan with one a mother of 4 kids who are all getting back to school and college and managing her stress. And then a couple that I work with, we also did a sort of a mini mindfulness exercise. And then I saw a boy in the afternoon that we also did using a timer and sort of watching the timer mindfully, trying to draw our attention. So I'm always trying to collect tools, and the SMART program has offered a lot. And the gratitude exercise is something I've incorporated. And at home I use it. I kind of do it all the time. I have 4 kids, but 2 of them are twin, almost 6-month-olds. And so when they were born, my practice went from sitting and doing some meditation, not unlike what Evie led us to a more movement-based practice because I was too tired to sit and stay awake. So I incorporated some of it, like the yoga and gentle kind of movements that we do, which is not something, I don't go to yoga classes every week. So I agree with how accessible it was for me and for patients, and that if one thing doesn't work for a child or an adolescent or a parent, there's something else that I can offer, sort of drawing on the program. So it's got a nice diversity to it. Yeah, and I really loved it. I think the camaraderie was a huge part of it. There was a lot. There was also, you didn't mention, but I think there's an active listening sort of exercise or day, and that one stood out to me too, just both with my work, because I think listening is one of our most important tools as clinicians, and especially in psychiatry, but also just in personal relationships, how little time I take and we might take to actively and openly listen to each other. So that was really rewarding and made me feel close to the people that I got to meet. And we're working on offering a mindfulness group to any employees down at the 1 South Prospect Street campus, and I've been helping to facilitate a mindfulness practice group just to come together and do these kind of practices, including I've borrowed from the SMART training for clinicians, mental health clinicians at the moment, and hoping to expand it. So it's a way to sort of practice what we preach and take care of our own wellness, hopefully reduce burnout. So I love it.
Hi, I'm Lisa Emerson. I'm the nurse manager of the inpatient pediatric unit in the comfort zone. So I manage 70 nurses, child life specialists, and support staff. And I was a very lucky nurse manager who was asked to participate in the SPART program. I don't even know how I got so lucky, but I have been a yoga practitioner for many years. Since like 1994, I've practiced yoga, and I've sort of taken a lot of classes on mindfulness, and this sort of seemed like a very natural progression because I've always tried to figure out how I might be able to bring this to my staff, because burnout is definitely a very real thing. High stress on an inpatient unit is a very real phenomena. So I couldn't quite figure out how to take my personal practice to my unit, and so this SMART program really offered me some great tools and some very concrete sort of talking points to be able to share with my staff and myself as well. I think that, the focus of minis, mindful moments, and just different ways to really create that more healthy existence, I guess. For my staff, I had this vision that I would lead all these mindfulness moments or meditation, moments, and it's really hard to sort of pull nurses off the floor for 5 minutes to sit down and breathe. So what I've really done with my staff is tried to incorporate it into little discussions. So if I have to sit down with a staff member, I may bring in different components of the SMART program to talk about stress management. I always try to send out a Friday email, and I usually put little tidbits of some sort of mindfulness in it, how they might be able to, take that minute before they enter a room while they're foaming in, and just take that moment to be present. So when they enter a room, they can enter it with a presence with that specific patient. Because, on a nursing unit, you're really running from room to room at times. It seems like you're just chasing lights. So it's a really great way to sort of bring people back to that moment and really to be present with their patients. A couple of other things I've done, I've gone to some different departments. I went to the lab and just spoke with their staff in staff meetings just about mindfulness and how they might bring it into their own daily life. They were having some issues with a lot of turnover and a lot of staff dissatisfaction. And so we talked a lot about how mindfulness and just having those moments for yourself for self-care can really help bring satisfaction into your day. And yeah, I think that pretty much covers it for me.
Hi, I'm Mary Streeter, and I'm a radiology physician extender. And I've been here for many years. And probably 25 years ago, I started practicing mindfulness as a personal need to manage the stress in my life. I got introduced to it, and it helped me balance my life in many ways. And throughout the years, I've pulled on it at more times, sometimes more times than others. But I began to see in the last few years this huge issue around burnout. And for a while I was working with pediatric patients, and then I was doing procedures on patients, and just in general seeing the growing stress in all of our lives, and seeing that patients needed tools to help them manage their medical experiences. I began to wonder if there was a potential for that. And so I started working with patients probably 10 years ago, just giving them some mindfulness tools to get through an MRI if they were a young child that didn't really need sedation, but was having a lot of anxiety around it. And that's mostly, and then as I began to do patients, I would just, patient care or procedures, I would share breathing techniques with them. And then in the last couple of years, it was more around the burnout with staff. And I did start to introduce some mindfulness, and radiologists aren't always wanting to be vulnerable in that way. A lot of physicians aren't wanting to be vulnerable in that way. But honestly, having been here 32 years, to think I was even being asked to talk about mindfulness got me really excited, that we were even in a place that we realized we needed as healthcare providers to take care of ourselves and put our oxygen masks on first, and that we needed tools to do that. So I saw that mindfulness was a great tool, but I also saw that it didn't work for everyone. And that's where the SMART program came in, which to me just has so many more tools in the toolbox for people to manage their stress and resilience. And so I began to pull some of those in for myself, going through the program. One thing was this group, because I have seen the need and so much potential in healthcare for this, but I've seen the lack of opportunity. So to come together as a community that work in healthcare, all sort of moving forward this way, is really exciting, I think. And then you do need that community to support you on that journey, because even though it's kind of at the foundation of your being, if you practice it, life pulls hard on us. So I think if we have people to help remind us, along with all the great teachers out there, it just helps make it more present in our life every day. And so that's why I think this community growing here and people here listening and wanting to learn about it is just really, really exciting, because I do think it's going to help us in so many ways, both as people, as patients, and leaders. So yeah, I think SMART, I think I've worked with all of these guys to talk about what would be the best program here, and I do think that this, just because of the variety of tools it has in it. And I actually am working with our residents. They're not quite open yet to do the whole SMART program, but I've worked with them a couple years, enough to know mindfulness is great, and about 50% of them were interested in just that tool, but a lot of them wanted some of these other tools. So I think that's where it's going to come in to meet our healthcare providers in different ways, just as with people in general. And I've also worked with the staff in radiology to incorporate some of the mindful moments. It is the biggest challenge, I think, in clinical care, because people have no time to stop to practice. I have done 10-minute sessions for people to drop in at, and I think that just helps people understand what is mindful meditation and experience it, and then they can take it and integrate it as they see fit in their day. But just incorporating moments of just hand washing, or entering a patient's room, or walking down the hallway, feeling your footsteps, anything to pull you into present moment awareness that can sort of reset our dials. And it can be brief, and it can be powerful. So I think for clinical care, it's a challenge, but I think where there's a will, there's a way. So.
Thank you, guys. I think now we'll open up for questions and discussion. So, any questions for anybody, myself or anybody on the panel, or about SMART, or?
I just wanted to ask one of the panelists to talk a little bit about the humor that's used as a technique for mindfulness and
Laughter is the best medicine. Yeah, actually, there was a whole component on the humor piece, and we all had a chance to come up with some jokes or funny stories and share those. And we had 20 people going through different humorous circumstances or joke telling and or making up jokes. And the laughter that ensued, we experienced it, and it was great. And I don't know that I have to sell anybody on laughter. I think it speaks for itself. We all know what it does for ourselves chemically. It activates endorphins and other healthy chemistry in the body, and releases tension and stress, and keeps us in the present moment. So it's actually one of the best strategies, really. And I love humor, so maybe you'll get a chance to experience a little of mine tonight. I don't know. We'll have to see. But anybody else?
Actually, one thing that stood out to me at the SMART program was the concept that your body doesn't really know if you're really laughing or just fake laughing, because after a minute, your endorphins kick in and you just relax. And I had this really bizarre opportunity to, someone asked me to lead a laughter yoga, and I had never really done it, and so I just thought, what the heck, let's try. And it was probably the funniest thing I've ever seen, because it started out with people just really uncomfortably laughing, and it just turned into the most hilarious, like, belly laughing that I probably have ever been involved in a room full of professionals. It was hilarious and actually very relaxing. Everyone afterwards just felt so, like, released something. So it was kind of cool.
I could speak to that a little bit. One of the fantasies I have, Betsy, is to have groups for parents of children with some kind of chronic condition. Because in my work, as you know, as a psychologist, work with pretty severely emotional and behaviorally disturbed kids. The parents are the ones who really could benefit from the stress management, and the domino effect and the impact that that then has on the children and the whole family is really remarkable. And so we don't have anything set up now, but that's a fantasy that I have, and we've talked about all along, about trying to get parents in for those who have a child with some kind of a chronic condition, and I think it'd be tremendously beneficial.
Those parents would be eligible for the pilot program, right? If they had, they'd have to have a chronic condition themselves.
Have to have a chronic condition themselves right now, but who doesn't? I mean, not really, but a lot of people have a medically diagnosed thyroid issue, hypertension, diabetes, what else, guys? Fibromyalgia. I mean, there's a lot of asthma, you know. Yeah. Yeah, good point. Yeah. So let's get a grant together. Other questions?
Were there any other techniques that just surprised you that seemed like they were coming out?
I think that what surprised me, not the techniques themselves, because I had some basic knowledge of most of them, but I think that what surprised me was my own. So as the leader in my unit, taking care of myself and managing my own stress really sort of created this, I was less reactive. And I think that my staff, even though I can't individually work with each of my staff on that piece, I think that my management of my own stress and my lack of reacting to everything definitely created a very different environment on my unit for my staff.
I think that's a great point. I notice also it's a domino effect. You know, it's like being in 12-step recovery. When one person in the family is in recovery, everybody in that family, whether they like it or not, is in some form of that recovery. You know, because when you change how you are, everyone around you responds or reacts differently. And so I think that's a great point.
I was also thinking of 2 exercises we did. One, they gave us a handful of words cut on little pieces of paper, and you just had to make, I think, anything out of them. A poem, yeah. And so it was very open-ended, not what I was expecting, and the variety of responses and humor. And the other exercise that surprised me was we read a story, if I remember right, that was about a rather sort of pessimistic person's outlook on the holidays or some events, and hearing different people's interpretations too, I think was helpful for me in thinking about different perspectives on the same sort of facts or the same situation, how we view that. So those are things I hadn't really thought of before, but are very useful and pretty easy to do in the clinical setting. So.
Another activity, I think you mentioned, Andy, we did an empathic listening exercise where you turned to someone you didn't know very well and you were to share something that was very meaningful and deep to you, certainly not your deepest, darkest thing, although there were a few tears shed, but and as a responder, you were to not say, oh, I know how you feel, that happened to me once, but you were to just listen and acknowledge without any judgment or anything, and then you did it in the reverse, and then we talked about how it felt to be really listened to. And, you know, when you think about it, you know, often you're talking to somebody and you see they're gone. You know, they're just not present, they're just not listening, and so it was really an interesting experience to feel really listened to and to really, you know, be able to really listen to someone else. And as healthcare practitioners, I mean, what could be more important than to go in that room? And this is what we're doing with the medical residents also. One of my texts was, you know, when you're cleansing your hands, put the past patient behind you and go into your next patient with a new eye and an open mind, and you are there for them, you know, basically. And, you know, that's got to be a good listener. So that was a good exercise for me. Other questions? Yep. That's really a good question. That's actually one of the rule-outs from the Benson Henry folks, that unless you're in pretty good recovery, it might at a certain point, after you have recovered, after you have probably sobered up for maybe a year, I don't know what time limit they set on it, but not for an active user or someone actively detoxing or anything like that. It's the same for a mental health issue. If you're in a severe crisis, it's not the time. You really have to have a open and a clear mind and be receptive and ready and want to. And so I think at some point, people in recovery, it would be a good option, but I wouldn't say as a treatment for addiction. That makes sense. Other questions? Comments? Anybody using such practices in their own lives or in their practice? Yay, Lori, we know, yes. And what do you practice? How? Meditation. You find that beneficial? Movement, yeah, yoga, dance. Any of those activities that really, you know, meditation is just about stopping your to-do list. You know, I like to put it that simply. It's just about shutting up your brain, and whatever that takes. It could be music, it could be dance, it could be conscious guided meditation, it could be a quiet, internally driven, quiet time, it could be baking, it could be scrubbing your refrigerator with a toothbrush. It's really just quieting your mind of that list and those negative thoughts that we sometimes have, and the worries and the anxieties and the what ifs and why didn't I could have said that and I didn't. You know, it's shutting all that up, even for 5 minutes a day, can have a big impact on your physical and psychological state.
I wanted to share a way that we're using this aspects of this program in radiology for women undergoing breast biopsies. And that is just to give them an opportunity. I do think giving patients this as a tool is very empowering about their healthcare experience. So women that are having a schedule for ultrasound or image-guided breast biopsy will receive a meditation. And within that meditation, to listen to, it's about a 10-minute meditation, and recommend that they listen to it for at least 3 days prior, for once or twice a day. And within that, they set some end results for themselves, so they sort of get an opportunity to create a scenario, a guided imagery, where as they would like to feel after the procedure, or in 6 months after. So you set up different scenarios for your outcomes, and then you create this guided imagery that is woven into the meditation. And then when they come in, they have some breathing techniques that they listen to prior to their procedure, just to elicit the relaxation response. So, and we've been doing that in MRI for people, just to sort of give them an empowerment tool, to something to take their mind somewhere else during that difficult time of stress. So it's been, the outcomes have been really good. We're actually doing a research program on it now, but that's just one example. I think it's been used in surgery a lot to prepare for surgery, Heal Faster. A woman created that program that pulls on a lot of these similar techniques. And again, I just think when patients come in and they have something that they can control around their experience, it actually, the research does show the outcomes are better.
This slide was so interesting about the prevalence of burnout amongst the practitioners. As a community member, if it's been proven, the science is there, what is the drive to insist that providers are taking at least the minimal 6-hour load versus waiting for people to be enlightened to then access that? That is a great question. So why don't we just automatically do this for everybody? Probably money is the number one factor, and again, I mentioned Blue Cross Blue Shield supporting us, which was groundbreaking. I mean, this doesn't happen. The insurance companies don't get involved in this, and people aren't really, this is still, to some people, they roll their eyes. I tell people, and they're like, oh yeah, she's one of them. It's getting people to buy in, which is why we did our pilot with the key personnel and high stakeholders, to show them this isn't nuts, this isn't crazy. Most people were preaching to the choir, but there were a few people in the group who came in like, what is this? And they are some of our biggest fans now. So it's really, there needs to be a lot of education about the benefit of this, and about different programs that can happen, about economically supporting this. So 3 of us are getting trained, but who's going to provide us money to provide the trainings? It doesn't happen for free, things like that. And so I think it's probably about money. Yeah.
Providing more opportunities like this program. And both Evelyn and I do sit on some of those teams. And I think that mindfulness doesn't work for everybody. You can't force people to do it. And it doesn't solve all the problems, but it's certainly an opportunity that we're trying to provide for more healthcare providers. And I think we've done a lot more impact here than we've done before. So it's a slow process, and figuring out how to make it work and run organizations doesn't happen. Things are happening.
And there are a lot of people that want it, but there is a lot of resistance also. I just know.
And I also want to give a shout out to us, because think about how far we've come in the year or year and a half since we've met. I mean, we've run the training, we've got the grant, people are interested, they're lining up at the door. And so the more this happens, the more we're going to be funded, the more people are going to be able to take part in these kinds of events. Yeah.
So the cost of replacing any healthcare provider that leaves the medical center is also high. We have pretty high turnover rate.
And I think, like I said earlier, I think they're doing that at Mass General. They're actually doing the training with physicians, instead, not the 6-hour training, the full 16-hour training. And the docs are showing up and they're loving it. So, you know, it's a time commitment too. It's a big piece of the day when you're doing the training. And so, you know, that's a piece as well. But maybe they'll do that for us, that research for us, and then we can feed off that. And they certainly do it in collaboration with us. They've been extremely collaborative and are very much involved in all the research we're gathering and whatnot. So
I think the real key is the medical student and resident incorporating it in their training is where it's going to...
And that was my initial thought, is why are we not doing this with med students, right? So instead we make the curriculum pass-fail. Okay, so the first 2 years of med students are a little easier, and when they go to clerkship, they fall apart. Well, duh, you have not taught them how to deal with stress. It's like, you know, letting your kids not have homework for 5 years and then putting them in 7th grade with a ton of homework. You know, this is not the best way to operate. And so, you know, my first passion was to get this in the first year med school curriculum. And, you know, honestly, there is some resistance. I'll just put it like that.
I think one of the strategic goals around the University of Vermont Med Center is around patient and family-centered care. Really, you probably heard of that. And my biggest contribution there is really looking at employees there, their own self-care. Because if the employees are showing up at bedside, burned out, stressed out, they're really not showing up there for the patient in the way that we really want them to. And they don't really want to be stressed out and burnt out either. And so this program really dovetails nicely. Like nursing has picked it up. Our nursing officer is a component of mindfulness. She's created, Mary has been part of that. Has done a lot with nursing on incorporating self-care into that model of patient family-centered care. Because the only way that model is going to be successful is if the employees are taking care of themselves to provide excellent care. So it's a really great plan. It's a great strategic initiative that we're all working for. And I think this fits in really nicely with that. Lisa Monfort. Exactly. And that we hear next week.
Yes.
Since you started the program, why would you wait that long? Why would you start with
It should start with our children. I mean, I wish I knew what I knew now. My daughter's 28. Why didn't I know this when she was 3 and I was reading her books, you know? I think you're absolutely right. We start as early as we possibly can. And, you know, we've got the wellness dorm at UVM, which is remarkable, and it's certainly an innovative piece. And so starting with the undergraduate students, but again, taking it to your children. There's plenty of materials now. There's meditation tapes for kids. There's great books. I mean, there's good stuff out there. I'm sorry I missed that wave.
I actually think they really are introducing it in elementary schools now.
Some are.
Yeah.
Some are, and some are resistant. I've worked in some where
Yeah.
they are resistant and feel that it's gobbledygook. So it's a mixed bag. You know, we're getting there. We're getting there. Anyone else? Thank you, everybody, for coming out. You can see me after if you have any questions. I appreciate you all being here. And thank you so much to our panel and for everybody for coming.